Hello and welcome to the University of Sunderland Roundtable. We are the Wellbeing team and we're here to discuss World Mental Health Day. With mental health being so prevalent in the press and in the communities, it's important to discuss these things on a university level and tell everyone about what we do and our experiences here at the university. We'll start off by introducing ourselves.
Hiya, my name is Ian and I am one of the welfare advisors here at Sunderland University.
Hi Greg, I'm Lizzie. I'm one of the mental wellbeing advisors at the university.
Hi, I'm Stephen Alabi. I'm on the project Channel Light, just working with the student support services and student journey services all through the program available for mental health support for Black, Asian minority students.
And as I said, my name is Greg. I'm one of the wellbeing advisors here. Now, I deliver low-intensity CBT, do solution-focused therapies, run lots of different workshops throughout the university, as well as running Silver Cloud, which is really important to our local community. Now, we're here for World Mental Health Day, so what we'll start off is a discussion what's available here at the university.
Right, lots of things available in terms of what students are available to access, and I think it's really important that students are aware of what's available. We're doing inductions at the moment to say to people, this is what's available in terms of support. I think it's super important that we're visible, students know how to access us and where to go, in terms of what's available. So I work for the welfare team. We're doing all kinds of events and things at the moment between myself and Bronte, my colleague, and also just sort of light touch things, various different types of support, but also just being able to refer them on to, anybody within the team to do other things. So if it could be counselling, it could be mental health advisors, or yourself, Stephen. I don't know. How would you describe what the mental health advisors do within the team?
So we work a lot more with sort of students that maybe have complex mental health difficulties or maybe have just received a diagnosis. Maybe you've been open to previous mental health teams. We get a lot of students that have maybe moved away to come to Sunderland and need to link in with, local services, GPs and things like that. But we can offer sort of, that 4 to 6 session intervention as well. And we understand, especially at the start of term, that students that are coming could be quite overwhelmed with sort of that transition to university. So we can offer that support and get them linked in with sort of, the appropriate external services if they need to. Or it might be just that we'll deliver that intervention and it'll be, that'll be okay for them from there. So that's sort of the basis on what my work is. I don't know if you want to say that. Sorry.
Oh, and as for me, the university put out data recently and realized that students from Black, Asian minority community are less accessing the services available. So as a previous student of the university with so much experience with the services and all, so my role is basically to signpost these students to stand as a gap between the student and the services available, getting closer to them, to interact with them, and get what kind of help they might need at different point in time and signpost them to the right source. Yeah, so.
Brilliant. Now we're looking at mental health for World Mental Health Day being a universal right. Do you think we treat that appropriately here at the university?
I definitely think so, but I think sometimes students don't always know what that consists of, how that works. Sort of what exactly does that mean? Sort of what are my my rights within that? And if I want support, how do I access it? So I don't know, if you were a student, how would you access support within the team?
There's several different ways we've got here, isn't there? Because people like to do it in different ways. So we've got, as individuals, people can come to us, they can come to Wellbeing and they can access support in loads and loads of different ways that we've got. But we've got online support through things like Silver Cloud and Togetherall, which is really, really helpful to those that don't want to approach us immediately. Now, I know through some groups and diversity, some don't want to approach us immediately, do they, Stephen? And we find that. And that can be an issue. So it's good that we've got you here to engage the students into that.
Yeah. So what I'll say on that is students, based on the background and where they come from, mental health is less emphasized. I would say there's not so much awareness on mental health, and mental health is often tagged as a weakness and the social stigma attached. And for Nigeria example, where I come from, social mental health is tagged as as a social stigma.
Yeah.
And people don't want to be associated with that. For example, the first, in 1916, the act that came out, Lunacy Act, really permits the government to detain people, put them in shackles, in chain, and all of that from mental health. And till recently, there's no emergency mental health service and no quite working system for mental health service. So for students coming from this background, mental health, poor mental health illness is definitely what they don't want to be associated with. Because they don't want to be perceived as weak, as unable to thrive. So what they do most times is just far away from the elephant in the room. And now it comes back to me telling them that, yeah, the school is accessible. These services are available for you. You can go here, you can go there, you can meet the wellbeing advisors, you can go to Silver Cloud, you can use TogetherAll, you can use Umi, and all these services are available. And they are very non-judgmental, they're confidential, and you could actually get yourself into a community and feel welcome. So
I think that's brilliant, and that's getting it from being it's not a universal right. It's in Nigeria, it's not, and then moving over to it's a cultural shift. Moving over here to the UK and finding that actually, no, we're really accepting. And I find that a lot when we do initial appointments, when people come here, people with different ethnic backgrounds, especially Nigeria, because we've got a lot of Nigerian students here, when I'm trying to get them to refer to disability. And it could sometimes be a real battle. And they say they don't want to refer to disability because they don't want to say at some point that they're disabled.
About sort of like recognising, like I've talked a lot about like diagnosis. But some people say, oh, well, I don't want to like get that mental health support. I don't want to go and see the wellbeing team because I don't have a diagnosis and I don't feel like, you know, my mental health's that bad at the moment. But what we would always say is come and see us. So, you know, we can offer support for like low level anxiety, whether that's just for, you know, anxious about an exam or I've got a deadline coming up, I'm feeling a little bit overwhelmed. It doesn't have to be sort of, you know, that you've got to have a diagnosis. It could just be that it's a certain period as well. I think that's really important because I feel like a lot of people don't come and see us in sort of, you know, in those situations as well.
Do you think they worry because these students are on a visa and they're going to be actually heading back to Nigeria that this would stick with them?
I was reading through some piece earlier this morning and for the Chinese student now, which are part of the Asian community, mental health to them is more of a reputation. It dents their social reputation and it makes them not fit into their family and some of the religious belief, misconceptions, and again, stigma again attached to mental health. For a Chinese, I would say part of it is the fear of maybe I won't be able to complete my program. For example, someone on nursing program that will be administering mental health service to a patient out there, if they declare a particular mental disability, it's going to definitely affect their graduation with the course. And it's going to affect their practicing as a core professional in the field they want. So all this put together with the back end of it, which is returning back to their country without achieving what they came here for, all this put a kind of fear in their mind, a kind of anxiety and not ready to talk or declare their mental health state. And outside that, again, it boils back to what Lizzie said on diagnosis. There's no efficient means of diagnosing mental health. Some of these students might have observed one or two symptoms of mental health illness, but they're not so sure what is wrong with them. So really declaring or going for a diagnosis when the service is not available becomes an issue for them. So most of them come into the environment, the university, without knowing what kind of diagnosis or without really understanding what is wrong with their mental health. So, but along the line, traveling over the new academic environment, the new challenges, the new expectation on them, everything complicates and makes them like overwhelmed, and you start seeing some of the outcome that they boil down to.
So, Stephen, I mean, it does. It's kind of, there's a lot of pressure there, isn't there? Sort of, certainly for kind of, well, exactly. And obviously not just international students, all of our students. And I think picking up on, you mentioned isolation before. We talked about cultural difference. I think at this time of year, that sort of feeling of isolation, homesickness, you've just started in a completely new environment with new people, unfamiliar environment. It's kind of, you know, it can be quite a big deal for quite a lot of students, can't it? Particularly at this time. And
this time of year is really important because social dynamics happen so quickly. Bonds form really quickly, especially when you're here at university. So I think it's a really key time for us to intervene with people leading up to World Mental Health Day. Those first 4 weeks when you're at university, to help students build those bonds, make those relationships, help them build trust while they're here at the university. And I think one of the things that we offer that we really need to actually get out there to students is the anonymity of our services, and that everything is private and confidential. When people approach us, we don't even go interdepartmentally unless there's risk involved, which is what we have to do that at that point. And I think that's a very good service that we offer. I think it's also important to say that we're linked to other services as well, though. We're talking about ways that people can approach us, and I think we offer out of hours, don't we, Lizzie, which is brilliant here.
Yeah, so that has been sort of something that we've had for, I think, about 2 years now. So the out of hours advisors are there from 6:30 on a night to then 6:30 on a morning. So we recognise that obviously, you know, mental health doesn't happen between 9 till 5, especially for students that maybe are in accommodation, or a lot of students might do sort of work during the night, in the evening, during the night and things like that, so they can ring, you know, our out of hours advisors. We would always say, you know, if they're experiencing mental health decline, to ring the out of hours advisors, but they can just be there for like emotionally supportive conversation as well, and because they are based in the accommodations, like popping down and having a chat with them, even if it's just sort of, you know, to have a couple with them or something like that, and it's just sort of that emotional support. So yeah, we are really proud that we've got our out of hours service, and yeah, we just want to make them, you know, more people more aware, because they are a relatively new service. We do want to get the word out that they are there, especially for the new students that have arrived obviously in September.
We link with a lot of other services, don't we? Both internally, so kind of I feel like we have a great partnership with Student Union. You know, sort of we were at one of their events yesterday where we had far too much fun.
We did.
But we've got a good partnership, a good solid partnership with them. They're doing a lot of stuff at the moment for trying to get students involved in things. I think it's Have a Go week at the start of October for them and their societies. Externally, there's all sorts of, we've got kind of, you know, sort of police on campus, haven't we? PC Dan. We've got kind of linking with other various different places for kind of different relevant issues that a student might come to us with.
So speaking of collaboration, I would say working with the SU, working with the academic section of the university, the personal academic tutors, and the module leaders, the program leaders, it's quite a very efficient way of reaching out and creating this awareness we're intending to create about our mental health, because they see the student on a day-to-day activity. For example, as a student, my go-to contact would be the personal academic tutor, and would sit and have a chat about my academics. At the same time, it would be a very nice opportunity to bring about like a conversation on my mental health for students. So I think we have to intensify more on collaboration with different aspects of the university, from the SU down to the academic staff support, and everybody interfacing with students. So that's what I would say.
What tips would you give to students that are just starting university then?
Yeah, from my experience, I would say speak out early. Yeah, speak out early. That's just what I would say, because we know the expectation is you want to have a smooth experience all through the university, but life would happen and it becomes tough at some point in time. It becomes challenges, but you have to speak out, get the kind of help available, considering so much that the university is investing in support and well-being and all of that. So you just have to speak out early and get the right support so that you can be stable and you can see through your program. Yeah. So that's the summary of it.
Totally agree. For me, it would be like, speaking out early and just recognising maybe what you might have found difficult in the past. So I know I've touched on exam anxiety, so come and see us. I know, Greg, you offer a lot of support around anxieties, workshops, as that one-to-one support, the Silver Cloud. But we can link in with sort of disability services as well, so they might be able to put reasonable adjustments in place for you. But obviously, if come and see us well before, if there has been a difficulty in your past or you notice those symptoms, just so we can get that support set up in plenty of time for you. Don't sort of wait until the week before of the exam. Just come and see us. We would rather that and have everything in place for you rather than sort of that anxiety escalating before the exam comes up.
Yeah, I'd want to normalise anxiety and stress, because they are the normal emotions. It's stress and anxiety are one of the reasons we've survived as a species.
Yeah.
Knowing that those things coming over the hill we should run away from and not go and cuddle them. It's a very important thing. But it's just the knowledge when it's getting too much and your body's responding in the wrong way. And that's when we can offer different support, and we have lots and lots of that in place. From a welfare perspective, would you offer anything different to students that are approaching the university?
Yes is the short answer. I mean, I think sort of following on from, what we've just been discussing, getting involved is one of the things that I like. Please get involved in things. There are lots. I've already talked about student union, but we've also got sports teams. There's things that are going on outside within the city of, sort of things that you can do. I think friendship groups forming early, that, sort of you've got to put yourself out there and get involved to avoid that sense of isolation much further down the road, don't you?
I mean, we do talk about mental health is a universal right, but part of the well-being here, well-being isn't just about mental health, is it? Your mental well-being is about your social groups, your finances being secure, your housing being secure, you being safe. It's a lot of different things that are included in this, and it's about aroundness and overall well-being, not just that mental health.
And I think it's important, to recognise that as a university, obviously, we know students here to complete the studies, they want to do well with that academic work, but we realise that for a lot of students that university isn't their only responsibility. They have got sort of families, they've got external sort of responsibility as well, and we'll always consider that when we are looking at support. So it does broach beyond just my university work. We will sort of look at external circumstances as well. So
I think that's important. And for that, I think it's really important when, again, moving back to where students are first coming into university, one of the first things that they should do is go down and get a GP. Go down and get a dentist. I think it's really important to do that. I was talking to the doctors down at the Freshers' Fair who were there getting people to sign up yesterday and saying, actually, everyone can sign up. Now, in my head, I had a belief that there was a finite amount of spaces in there, and suddenly you had to get down there very quickly, but they said no. They will take absolutely everyone. So there's always going to be space while we're over here at the University for Students, and that's it's a weight off my mind that I'm not telling students that actually get in because they're going to fill up. Just get in.
Yeah.
But if you don't know how, then come and ask us.
Yes, absolutely.
Another reason why they should get in touch with the GP on time is because when you come in, the hospital needs to have a medical history of what your previous state is like, because they'll be able to build on this to give it to the best personalized service they can along the line. So if you check in, you sign up, they pull you an appointment and you visit them, they do some basic tests and check up for you. They know the current state of your physiology, of your well-being, your physical health and all. Then when something arises, they could easily know the best approach to it rather than just showing up when you're sick. Again, it boils down to early intervention and speaking up early, getting the support that you need so that anybody will be ready to offer you the kind of support when it's at that point. So it's really important that we should emphasize that students should get in touch with the GP and sign up for that. Yeah.
So we've talked a lot about that early intervention, and that early intervention, I think we all know, is absolutely key to success. But we do also experience the other side, don't we? We experience where students come to us later when they need help, when they become overwhelmed. So what kind of help and support do we offer at that point, do you think? Do you think that's enough?
So, I mean, from an academic point of view, if, as I know I've mentioned sort of exams and deadlines and things like that, if, you've got a lot of deadlines coming up, you've had maybe external circumstances that have affected that, you've been quite overwhelmed by the move to Sunderland, come and speak to us, because we can have sort of good relationships with your academic staff with sort of your consent, and they can discuss sort of extenuating circumstances with you, maybe some extensions. There is flexibility there. We understand that it's not going to be a straight path for a lot of students, and you certainly won't be the first and last that have asked for that help. But again, we do have teams, sort of like the progression team, that can help you with that process if you are needing to apply for things like that. If sort of, there is sort of options to take breaks from university and things like that as well, if it's got to the point where maybe you don't feel like you're able to sort of complete the studies at that time, but we'll always be there to support you to sort of through any process that you choose, really.
I think it's good you mentioned different teams there. You mentioned the progression team, we've mentioned the disability team, and we're all linked together, aren't we? We're all part of Student Journey, and I think that's really important, those close links that we've developed together, because we're all involved in mental health. All of these things are impacting our mental health.
And all staff will have that understanding as well. So like Stephen said, like personal tutors, academic staff, it's not just sort of the wellbeing team that have got the understanding, yes, we deliver that support for that, but, you know, personal tutors will have that background mental health and be able to point you in the right direction, or even just offer you, you know, maybe that's the support that you need and we can link with them if easier. So yeah, there's always that understanding, isn't there, really?
It is. I think, again, it's universal, it's wraparound care. Now, even getting involved in the sports teams, doing that physical exercise, doing all of that is brilliant for your mental health. It actually changes your cognition, doing that physical exercise as well, if you're stressed and if you're anxious.
And it's just that family thing as well, that kind of, you know, being part of, whether it's a sports team, whether it's the knitting group, whatever it might be, there are lots of things that you can become involved in. And because you go there on a regular basis, you meet new people, make new friendships, and that kind of, that's a big part of, you know, we then don't need to have some of those interventions.
I know when I was a student here, like, I always got told that, yeah, your academic work is really important, but actually it's all the other stuff that comes with university. It's the groups, it's societies, it's socialising, it's getting involved with the university community as well. It's not just about doing your degree and then, you know, it's about those sort of connections you make as well. So I think that's really important.
It is, and I think as well, from talking to these groups as well, some of them don't just stop at university. I was talking to the choir, and they are alumni, still go down there. The Gaming Society as well, they meet at a weekend. I was talking to them at the Freshers' Fair as well. And the people who run it have left here for 20 years. So they're still engaged in the university, still making these connections, still helping people make those bonds, which are really, really important. Moving back to the overall discussion, is mental health, is it a universal right? Do we feel like it is, then, after the conversation?
I think everyone's got the right to have good mental health. I think it comes obviously with understanding that there will be dips and bumps in the road, but actually it's about sort of knowing what support's available and building sort of like a toolkit for yourself and having those strategies available, so when you do hit that bump, you know where to go or what you can do to sort of, you know, overcome that. And I think that's really important, and obviously we're there to sort of help people build on that, aren't we? So.
And knowing it's, you know, just, it is. It's knowing if you do need help, rather than just as many people do, you know, just holding on to things, that'd be all right. Reaching out, but also knowing how to, where to, because sometimes it's not always obvious if you're a student who's struggling, and sometimes those things can just hit you straight away. There's not always a pre-warning, is there? Some circumstances can just pop up, and you need the help sort of straight away.
It's interesting, we're talking about generally students, it's hard to bring them into us, and that's students generally from the UK we're talking about as well. So it must be even harder and more difficult for students from different backgrounds to come in, especially with those cultural impacts that are on them from coming from different countries.
I would say, I know the World Health Organization is doing so much to generalize and make mental health a universal human right, just like every kind of health, because health is taking a holistic view at what health is all about, the physical, the mental, the social, and the emotional. So if one part is lacking, then definitely the other side will be lacking. And knowing again that there are some social determinants of health, like you've highlighted before, the housing, the finances, the employment status, and the living conditions and all of that. So all this put together, some of our students might not have had the best experience way back, and still they're in a new environment and they're still trying to fit in. So I would say for such students, they wouldn't understand what it means to really have the basic fundamental right of maybe accessing mental health screening services and all of that. Now, coming down to the environment, myself and the team have a lot to do with really getting the students to know that now you're in this environment and it is your right to access this support, it is your right to access this and all of that. So my one-on-one contact with students, because my project Channel Light, the objective include being a talking head with this student and engaging them in one-on-one conversations with any opportunity that I need to, making every corner count with them. So what I do is I tell them, you now in this environment, you have to look after this, and it is your right to do this. You're here now, you have to adjust to the new situation, condition you find yourself, knowing that there are a lot of people around to support you. So it's still being very much available for them at any point in time that they really want to talk, or they want to reach out. Yeah.
I think it's about recognising like the understandings there, isn't it, here, and it can be really difficult to sort of recognise that, can't it, especially for sort of those minority groups, which, yeah.
I think it's important that it is. It seems like it is. It's a universal right here, now, where we are. And it's also important, you think, that students take on their own reflections and that they have responsibilities within these rights. So you come over here, you have this right to a doctor, you have this right to help, you have this right to support, but it's your responsibility to actually approach and get that help and get that support. Especially early intervention is key at that time that we've talked about before. And I think that's really important for everyone to realise that.
Yeah, I mean, it is, you know, sort of that certainly we can do. There's a lot that we can help, guide, support with, but yes, ultimately kind of responsibility lies with individuals, and we're not gonna leave people kind of, you know, struggling, but they do need to, they need to do their own signing up for certain things and take that step forwards. That part is part of the university journey as well, isn't it?
Absolutely, yeah, absolutely. Right, thank you very much there for listening to our roundtable from the Wellbeing team. We hope it's been really helpful to you. Thank you for listening.